guys, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk to you about something that not everyone enjoys discussing, so hear me out, but it is really, really important to the safety of your practice, and that is consent forms.
It is. I feel like that word kind of weighs heavy on some team members. Consent forms are so important. We have a lot of offices and locations that are utilizing consents, but some of the way that some offices utilize them is not going to be protective enough for the practice. So if you have technology in your office and you're able to send out consents digitally, that is wonderful, but we need to make sure that we are collecting all the information on our consents that's going to protect our practice. On top of that is having separate consents.
I'm going to pause for a second because you said the word everyone's dreading, which is separate. Yes, because I mean, how many times do we have doctors and they're like, "Can I just have like one consent that covers everything?" And we really want to say yes, but we can't do that. Can you talk through why?
You can't. So if you had one consent that covered all the procedures in your location, imagine how long that consent form would be. I'm thinking like 300 pages probably for everything. That's a lot to expect your patients to actually read through and understand.
Yes.
I want my patients to understand what they're signing because your consent form is going to have your pre-op information and your post-op, and that is so important for the procedure to go correctly in the long run.
Well, and it varies by procedure.
Sure
right?
does.
So, okay, very good.
So we need to have a consent for each procedure. And guys, I am speaking about every little procedure, so from fillings to Botox to crowns to endo. Every single thing that we do, we would need a consent form for. Now, if you're doing multiple composites, one consent form's fine. You just need to list them all on the day that you're actually doing the treatment. But we need to have not only the patient signature, and this is really important and gets missed a lot, the doctor's signature and a witness.
I'm glad that you said that because a lot of those digital platforms, they don't have that,
They
right?
don't.
I mean, and we can have a whole conversation on why we can't send a consent form in advance. Like they need to sign it in person with us
They
so that
do.
we can answer questions.
They do.
But you know, having those digital signatures in the forms, it is great. And gosh, we love technology, but that makes our life easier. And guys, that's not about us. That's about protecting the patient and educating the patient, but also protecting the practice.
Protecting the practice in a whole. If you would like to pre-send your consents out to your patients, that's wonderful. It gives them time to actually read it, where it's not impeding on the time that they could be in the chair with you. But I think the signatures need to be done in person and in front of either somebody at the front that's greeting them and then the doctor signs. But I actually prefer it to be done in the clinical space. Yes. Keep a copy in the back of the clinical and up front. If you want to hand your patients, since there's some time, the consents to read, that's wonderful. I love my patients to be educated. That way we're not catching them by surprise once they get into the clinical space. But in the clinical space is when consent should be signed, not only by the assistant, but by the doctor as well.
Well, and that also means we have to be really proactive with things because what we can't do is wait till the last minute and the day of a procedure when we know that we're about to sedate the patient, right?
Yes.
Or they show up and they've already got some Valium in them and it's like, okay, now I'm supposed to have a conversation with them. Like we can't do that.
You can't.
So you have to have them sign it whenever you're scheduling that appointment, right?
Yes. If they are sedated, a patient cannot sign any consents or anything about any kind of financial agreements, agreeing to anything if they are under sedation. And that is light sedation and or heavy sedation. And you also cannot have the responsible party that is bringing them sign the consent form for treatment on them because they are an adult and they need to actually give consent themselves. So that needs to be done beforehand at the pre-op appointment.
Love that. Well, and you know, as much as nobody likes talking about consent forms, guys, this is super important, even down to, you know, everything at Bizrok with our training. We're teaching you how to be more efficient and effective with your time. We're also teaching you how to be proactive. So Rebecca, one of the things that you just talked about was pre and post-op, which also means we've got to be proactive with educating for post-op instructions before the day of the appointment, right?
Yes, please. I always do post-op at the same time as my pre-op appointment. So when I'm giving them their prescriptions for whatever medication they're going to take for the day of the appointment, I go over their pre-op and their post-op and then make sure they don't have any questions. And to actually make sure your consents get scanned into the system is the last key item that you need to make sure is happening. The patients not only need to sign them along with a doctor and a witness, we need to actually scan them and then shred them afterwards. But they should be scanned the same day as treatment so that the scan date is the same day as the treatment.
Yes, love that. And I know, guys, if you've done the clinical trainings with us in the past, we have sample consents for days. Like we have a whole book. So if you need help or if you're like, I don't even know where to start, reach out to us. We can
Please.
provide you with a sample consent. But also, so many of you have great resources through your HIPAA or OSHA groups. And so they have sample consents for all of the procedures that are being provided in your office. So please reach out, leverage us, leverage your resources. We're happy to help and serve in any way. So as always, guys, we look forward to seeing you and serving you soon.